right, time now for a look at your health. Our topic tonight, very timely. It's about back-to-school safety and health. Yes, a to-do and checklist for you, and Dr. Mitchel Goldman from UCSD is here with a checklist to remind us of all the things we need to get done before that school bell rings.
And some people are going back to school in 2 weeks, some after Labor Day. But if you want to get your kids in a checkup, you've got to call your pediatrician now, because everyone's getting booked up with the back-to-school physicals.
Yeah, and that's not even to get the flu shots yet. That comes a little bit later down the road. So let's talk about this checklist that you've devised for health and safety. We're going to put it up on the screen for our viewers and run through it. And I know you're a bicyclist, so you put that one on there for sure about wearing a bike helmet right off the bat.
And it's the law, so every child has to have a helmet. So that's just a no-brainer. But some of the things that you may not remember or may not think about is you want to have like a code word for the kids, because if someone else has to pick your child up from school, your child needs to know that it's a safe person to pick up. And so sometimes having a code word that will allow your child to know that this person is safe that can pick you up.
And that's reviewing the safety rules. And when you talk about keeping open door conversations, a lot of this has to do with the epidemic of bullying, correct?
It really is. And whether your child is 12 or 8, bullying does happen in school. One of my employees, their son Tristan, was using a backpack to school because, as we're going to talk about, some of the backpacks are so heavy. So he was carrying it in a roller bag, and he was bullied. And the kids tore apart the roller bag and threw it away. And so that should be addressed immediately.
And also the backpacks, it's important not to overload them because it can cause neck and back problems, correct?
Really, and you really shouldn't have more than 20% of the child's weight in the backpack. Now, one of the things that I'm finding is that girls, it's not cool to wear a backpack, so they like to wear a shoulder pack. The problem, of course, is that's going to throw their shoulders out. So even the girls try to find a fancy backpack or one that's stylish enough that they can wear it on their back. The important thing we were talking about off air is, you know, some schools will have one set of books for the school and one set of books for home, because we all know many schools don't have lockers anymore. The day's got to come where they have a pad like an iPad where all the textbooks are going to be on that. But until that time comes, we really have to protect our kids' backs.
And last on the list is getting that physical, that checkup before school, and keeping your immunizations current. Let's show the immunizations that you need to make sure that your soon-to-be student needs to have.
Now, the immunizations are very important, not just for the health and safety of your son or daughter, but also those around him. So you have to have polio, the DTP, which is diphtheria, tetanus, and pertussis, measles, mumps, rubella, hepatitis B, varicella, which is chickenpox, and then a new one, the HPV, which is Gardasil. And those are very important things to immunize your children. Now, if you've got kids going to college, there's meningococcal vaccines, but we're mostly talking about the young kids, but it's very important.
And that's meningitis, correct?
Yes, because when you get a lot of people in an enclosed area, you know, if someone has an infection, it can spread, and meningitis is an infection that actually goes to the brain, and so it can be very dangerous.
Do you have any advice for parents in talking to the school nurses? I know a lot of schools don't even have them anymore, but in terms of health and your relationship with the school.
You need to let the nurse and the school know if your child has any needs. If they're allergic to any specific compound, make sure they have an EpiPen, or the school has an EpiPen. Or if they have asthma, make sure that there's an inhaler. Just the common sense thing. So if you're away from your child's in school, something happens, that school nurse knows. And then finally, because I'm a dermatologist, it's always good to look at your kids' skin. You know, make sure if your kids are going to be outdoors that they have sunscreen. But you want to check the skin, make sure that there's no moles or anything that's atypical, because we're finding an increased incidence of deadly form of skin cancer called melanoma, even in children. So again, part of the physical, look at your children's skin as well.
All right, from head to toe. Well, we're ready for back to school. Thank you. That's an important checklist, Dr. G. And he went all the way through medical school, Walter, so he must know something about school, because that took you forever, did it not?
And the books are really heavy.
Yeah, there you go.
That's a safe bet. All right, thanks, Kath.